Hello, and welcome to another edition of Eye on Matteson. I am your host, Laverne Murphy, and our executive producer of the show is our village president, Sheila Chalmers-Curran. On today's show, Eye on Matteson, I have Dr. Tyree Brinson here to share some helpful tips on how to cope with COVID, depression, emotional awareness, and things of that sort. So we're pleased to welcome Dr. Tyree Brinson of Olympia Fields. And we're here to greet him on the show and just find out a wealth of information. Dr. Tyree Brinson, thank you so much for joining Eye on Matteson.
Thanks for having me. It's my pleasure.
Great. Well, we're going to jump right in it because, of course, we've been going through the pandemic. Everyone is at the point where they just want to put this behind them, hoping that 2020 could have just taken the word with it, right? But it traveled over with us, unfortunately. So for individuals who are, getting fatigued with the COVID situation, what are some of your advice or tips that can help people manage during this time?
Absolutely. Excellent question. So as I'm pondering, just the term COVID fatigue, we have to be able to understand what we're all talking about. And when I think of COVID fatigue, I think about extreme tiredness, being worn out, being overwhelmed, mentally exhausted. The person may want to give up. They may lose interest, which may lead to reckless behavior. So, think about it. When you're tired of something, you want it to be over very quickly. So, so people can increase their knowledge about their own safety to start the process of becoming re-energized. Engaging in pleasurable activities are important. Working on some of those, goals they might have, staying regulated with staying on task, and don't try to hold feelings in. Talking about it may indeed be helpful. So we are seeing a varying effects of, just the idea about the virus having a negative effect on a person's psychological adjustment. And with the COVID-19, one of the interesting things about it is the length of time it has been here. Yeah. I conducted a workshop some months ago, and opening the workshop up, someone said, "Hey, doc, I only had like a month worth of dealing with this COVID, but now it's continuously going, and I don't know what to do." So that describes COVID fatigue. We feel powerless. If we all can just wave a magic wand, we'll say, "Hey, let's get this over with right now." So COVID fatigue is very instrumental in deciding, from the person's point of view, how much they can deal with, of course, COVID-19.
Right, absolutely. And, to make matters worse, we're into the winter blues as well. So, we have it twofold at this time. So I know it can be very challenging, but at the same time, there's a difference, I would imagine, and I'm asking you as the clinical psychologist, is there a difference between COVID fatigue and depression from COVID? How do you decipher the two?
Okay, well, the first prominent difference is COVID fatigue is not a mental health diagnosis. It's rather, nevertheless, it's an important factor on how individuals interpret their own outcome. So somebody can truly be fatigued from, dealing with COVID and not be clinically depressed. So we have to make that distinction. So if we look closely at depression, it significantly affects a person's capability to function, their capacity to function. They're irritable, they have irritable mood, loss of interest, feeling down, and in some cases, profound hopelessness. So we have to make that distinction. Now, what we know about COVID-19 is, imagine somebody having, depression, anxiety, we'll call them co-occurring, problems and disorders. And if we put COVID on top of those disorders, they will exacerbate that person's functioning. And that's some of the things that we in the mental health field have been seeing. So in other words, the regular person who may experience depression, now, depression don't stop for them to deal with COVID. So now they got to deal with COVID and, clinical depression. So combined, it's not a good mixture. So reaching out to mental health professionals, I would recommend if anybody's not, able to deal with COVID-19 and also some mental health concerns that they may have.
Right, absolutely. So, what advice would you give to individuals who, may be isolated and may live alone, may not have a large family or others in their home, and it's more of a challenge as well? What would you say to those individuals and how they can cope with any type of depression or just dealing with COVID as well?
Excellent question, Laverne. So it is very important during the pandemic. Of course, we have to keep our social distance. We got to, make sure we wash our hands, and just thinking about all of that. If you're living alone, you're like, hey, I can't go anywhere. So, but in this day and age, we have, things, like this platform, we're on Zoom. It's very important to keep those social connections strong. Make sure that a person engages with their support system and family members while they're at home, be goal directed, keep themselves busy. It's a great time, I tell people it's a great time to expand interests, during the COVID. Some people, I've treated, they learn how to cook different meals because they've been home, so they made home not just, seeming as though you're relegated to this dungeon until the pandemic is over, but they made that home environment, even if they're living alone, they made it more manageable because they're being, consistently engaged and learning different skills and, reaching out to those family members, even having, some social interaction through Zoom parties. I've heard of some Zoom parties. You can look on Facebook, you see all these people, with their Zoom and, talking about their friends who get on that Zoom. So I think that's very important if somebody is home, feeling isolated and also living alone.
Great. And then, but what about parents, right, of younger kids, teenagers for that matter, that's carrying a lot of stress? There's only so much family time you can do, but at the same time, you're concerned about the mental health of your child. I would even include myself in that scenario because it's hard, to make sure that our children are okay. What can you say to parents, and what are some of the signs we need to look for in our kids if they're not okay? What are the signs that we need to recognize?
Well, absolutely. So the first thing I'll tell parents, make sure you check on your children to see how they feel, because oftentimes, parents just overlook that I'm suffering, we're trying to figure out how to stay safe, but kid, will be okay. We just assume that that'll happen. So we have to check in on them. They may have many questions. They may indeed feel like, well, would this COVID ever end? Where are my friends? I'm not in school now. I'm having school online. It's not the same. So checking in on them, talking to them about COVID, talking to them about how to, keep, their friends engaged, through either playing video games with them. I know they have the headphone sets. So some of the things to look for in kids are just like adults. If you see that child, if you guys used to eat as a family and now the child say, hey, mom, hey, dad, I want to just eat in my room. So they're becoming more isolative, regarding the family. If you see they're more irritated than normal, because depression, in fact, looks different in children and adolescents than it does in adults. So if we see them, being more angry, not engaging in family activities, wanting to be left alone, like I said, and just overall not seeming like they are themselves, those are signs to check in. And if they need to be connected to some type of, mental health practitioner, that'll be the time to be able to, of course, do that.
Wow. So you brought up something interesting, Dr. Brinson. You said that you can recognize depression is different between kids, adolescents, and adults. What are the signs that one should recognize for any instability in an individual, an adult, and a teenager? You've kind of explained the the children part of it, but what about adolescent and what about an adult?
Oh,
What
yeah,
can we look
absolutely.
for?
The presentation, sometimes it's different, but the same hurt is there. The same
Yes.
sadness is there. We just have to be aware of, just even exploring and finding out what is wrong with this person. So what I mean by that, if let's look at just adolescents, if they are, just lashing out, maybe their sleep is being disturbed, maybe, I've seen, with a few patients of mine, their sleep, it's amazing because it just flipped. So now they're staying up all night and they're sleeping all through the day, and still have to, engage in online learning. So we look for signs like that to see if there's anything that's out of the ordinary, especially if the person did not have any history of any type of mood disorder. So if we're able, to look for those subtle changes, then we can react. So now for adults, maybe you'll be married, maybe you'll have a spouse, maybe you have some loved ones that you communicate with. If you find that they are, maybe even, a little bit more short on the calls, trying to hurry up and get off, maybe, you realize that they like working out and, they're not doing it. They might have gained some weight, so there are things that we can look for that are not the norm that can identify that we might need to take a closer look at this.
Okay. Okay. And sometimes it's hard, one-on-one. What would you recommend if a family member needs help? How does a family get together to create some type of intervention to get this individual help? What are some of those steps that a family would need to take?
Oh, absolutely. The first step is identifying the family member who's in distress. So, like I said a few minutes ago, if you are seeing some changes in how that person normally is, then that can be, a true sign that this person might be in some type of psychological distress. So let the family member know you are concerned. Find out, it could be something simple that, maybe each of you can work out. I'm not, trying to create a sense that the entire family have to come, because guess what? We still have to social distance. but one of the things we have to do, we have to show that family member that we are concerned. And oftentimes that concern and addressing it may be outside of the scope of the family members. So let that family member know that, you will accompany them if they need to have an appointment. And by the way, when I'm saying accompany them to a professional, we have, they don't have to leave out the comforts of their home, because we have Zoom, as a platform for people to receive mental health service. So I would just say, identify that, the issues, talk to the family member about some possible support. If needed, reach out to that mental health professional. Those, small things can be a huge benefit to that person, because it's being addressed sooner than later. And early intervention is always key. So we don't want people just to overlook it. And I know, as an example, years ago, everybody, I know, had an uncle in the back room, and we just don't go in that back room because there's some issues going on. Well, we don't want that, whatever's going on to just remain in the back room. We want to let them know we are concerned, and then start the process of doing something about it.
Right, absolutely. And so, when we talk about intervention, and, as an African American culture, there's a lot of reservation and there's a lot of stigma behind getting help, going to therapy, going to counseling. What would you say to those individuals who are having that type of attitude towards seeking help for some odd reason? Or why do you think that is there in the African American culture?
Well, I personally think it's there. We have this ingrained stigma related to all of these professionals, whether or not it's, your family physician, whether or not it's, the psychologist. Our history is contributing, is a contributing factor to that definitely. People not being able to find out who looks like them, in the mental health field can be a hindrance as well. Feeling like people will look upon them as being weak or not being able to manage their own problem leads to stigma, of course. Fear of being misdiagnosed, because again, we can recall some tragic things that happened, like the Tuskegee experiment, where African Americans were given syphilis, weren't told, and just watched the nature and course of that disease just ravage the people who got affected. So we don't want to be misdiagnosed, underdiagnosed, or over pathologized. We don't want to be labeled. And also, we have this idea in our community that we have to pray about it first. So that, absolutely is a factor. But I'm here as a psychologist just to let you know, when people come in to see me, if they want to pray, they're more than able and willing to. We don't judge them. We try to build trust, because we know that there may have been a lot of damage and people just, don't think that mental health therapy can help them. But what I found with first-time patients, they are relieved because now they are getting something that can really curtail the pathway that they were on that led them to whatever psychological problems they've been experiencing.
Wow. Great information. So that's great. That almost led me to my other question is, what can an individual, expect when they do come? And it may be lack of awareness of, some of the points that you hit on as far as it being historical, it's dating back, the mistrust and things like that. But for the newer generation and those who do want to take the step, what should they expect when they come to see you if they do have some problems? And one of the things your wife said that really stuck with me, she said, it's okay not to be okay.
Oh, absolutely.
And some people don't look at it like that, and so I really appreciate her just saying that. I thought it was so profound. But, like back to my question, what can an individual expect if they were to want to utilize your service?
Oh, absolutely. Very great. Very good question. The first thing they get is a safe space where they will be able to talk about some of those things that are, causing some of the complications in their life. We pride ourselves on confidentiality. So with that safe space, we will not divulge their information. Under most circumstances, I say most, because we are bound by law. If they are suicidal or homicidal, we must seek help. So they have a safe space. It'll give them the opportunity to build greater understanding of the nature and course of their distress. Oftentimes, people don't know why they're feeling like they're feeling. So individual therapy can explore some of those ways, as well as improving their ability to cope, improve their mood if that's one of the presenting problems. Also reduce and alleviate some of those symptoms. So in other words, we will provide some relief and instill hope. And with that, they're able to strengthen awareness of specific stressors and also gain that better overall mental health. So counseling is part of the process of their recovery. And people think sometimes when they come into therapy that it's a long, drawn out process. It all depends on what's going on with them. Some interventions, may take 2 to 3 weeks. Others may take a little bit longer, but all the people should know that when they come in to see the counselor, the therapist, the psychiatrist, they are there with, throughout that journey with you. So now it's like you've been experiencing something possibly alone, and now you got someone who's experienced to be able to walk with you along your journey to recovery.
And would I be correct to say they would be unbiased and non-judgmental as well?
Absolutely non-biased, and also they are not judgmental as well. That's one of the tenets. Confidentiality will be upheld. They will have that safe space. We won't judge them, and we are culturally, attuned to what may be going on with them. So we're going to give them the best of our expertise and also clinical knowledge.
Right. And so, Dr. Brinson, who do you service? Is it married couples, individuals, children? Is it across the board? What is your clientele, your customer base? Are you open to any age range?
Absolutely. We see people from childhood until older age or more experienced age. We've been serviced in the South suburbs for 12 years. And in my capacity as a psychologist, I've seen people that range from having mood disorders like depression, anxiety, maybe some psychotic symptoms. We do a number of psychological assessments, not only for people who may want to find out what's going on with them, but also we've serviced different police departments in fire departments to have some duty for fitness type evaluations. We also work with different surgeons, people going in for different types of surgeries. We do the pre-evaluation to make sure we can rule out any psychological problems. We work with different athletes. We had a contract with the NFL for a number of years, so we still see some athletes. So I consider our practice, sort of that hometown practice that services most needs of the community. So that can be through individual therapy, that can be through family therapy, couples therapy, marriage counseling, as well as group therapy. So we have all modalities of treatment. We just need people to, make that call. And oftentimes that first call is the most difficult, but we find that, if they have that family encouraging them, if they make that call for that first time, set up that appointment. I've not had one patient who resented the fact that they sought mental health therapy.
Great. And would addiction fall into that as well?
Absolutely, and I do like Laverne, the way you keep me on target. Addiction as well. So we treat a range of disorders, including addiction. But because you brought up addiction, let's say somebody has an addiction to a substance. Well, to treat that person, it may include other entities like a self-help group, like Narcotics Anonymous, maybe Alcohol, Anonymous. Maybe it'll include some psychopharmacological intervention, like seeing an addiction psychiatrist. So we, look at the person and the reason why they're coming in, and we make sure if we need some help to be able to deal with it, we're connecting them to those different entities that will allow best practice, for that treatment to be implemented.
Wow. You have been such a wealth of knowledge. I really appreciate you coming on the show. My final question was, if you have someone that's out there, that's just feeling like they're at the end of their rope, there's just no hope, what would you say to them if they're listening right now or watching this show? What would you say to that individual?
Well, I would say to them that they are not alone. If their issues are related to the pandemic, we absolutely know they're not alone, because the entire world at this moment is experiencing some of the same, symptoms of trying to cope. I would tell them to reach out to someone in your support system or family. Psychology Today is a website that a lot of people utilize. Let me tell you a little bit about Psychology Today. It's a psychologist or therapist directory. So they can simply put in their zip code. We'll get on the Psychology Today website, of course, put in their zip code under Therapist Finder, and it will populate all of the therapists who signed up for that particular publication. They can scroll through the different profiles of the people so they can find somebody, who they think they might have a good fit with. So again, they're not alone. We have online services. They don't even have to leave the comforts of their own home. Most of the insurance companies throughout the pandemic has approved, phone therapy. If the person, is older, maybe on Medicare and they don't have access to a computer, phone therapy has been approved, as well as, Zoom programs and other different online platforms to where the person, if you want to, seek help and get, somebody to be able to work with, there are resources out there. So I would just tell that person, reach out, to that family member, reach out to, either your primary care, because oftentimes they are the first line of defense. Tell somebody that, you are suffering, and hopefully you will make that first move to go see a clinical psychologist who happens to be licensed, who can, use evidence-based research to be able to help whatever is ailing the person.
Wow, thank you so much. So Dr. Brinson, if someone wanted to reach out to you, how can they contact you?
Absolutely. Our phone number is 773-727-9417. We have a website. That website is Tyree, Tyree.com. And through that website, they can email and set up an appointment.
Great. Thank you so much. And hopefully, Dr. Brinson, we've helped someone today, through all the information that you were sharing today, because it's real. We're all going through something. We're in the same storm, but we're in different boats. So I just hope that, you've helped someone today with all of your information. And I want to thank you for coming on Eye on Matteson.
It was my
So
pleasure. I look
great.
forward to working with you in the future. At any point, if I can be of assistance as a psychologist, just please reach out and just communicate with me.
Yes, absolutely. Thank you again, Dr. Brinson. And thank you for tuning in to Eye on Matteson. Again, I'm your host, Laverne Murphy, our executive producer, our president, Sheila Chalmers-Curran. Until next time, stay tuned, stay informed, and get involved. Thank you so much for choosing Eye on Matteson.